Good evening, parents. Welcome to our special live workshop in which we will be focusing on a very important topic: how to strengthen infant immunity against RSV. RSV, or Respiratory Syncytial Virus, is a virus that affects the lungs and the airways. It gives rise to symptoms that are somewhat similar to common cold. According to a research by the National Institute of Allergy and Infectious Diseases, RSV affects an estimated 64 million people and causes 160,000 deaths each year. Another report by the National Institute of Health suggests that the rates of RSV detection are quite high in younger age groups, lying in the age group of 0 to 5 years as compared to older children. The report also states that the cases of RSV peak during the monsoons and winters. In today's session, we have with us Dr. Jaydeep Choudhury, who will elaborate on the topic and help us understand how we can protect our infants from this potentially life threatening disease. Welcome, Dr. Jaydeep.
Thank you. Nice to be in this platform.
Thank you for joining us. Please share your thoughts on today's topic.
Respiratory syncytial virus is an universal virus. It's present everywhere in all parts of the world. In India, there is a particular seasonality. It usually in the monsoon and peri-monsoon time, and also during the winter. Now, among the various viruses that affect the respiratory system of very small babies and infants, RSV is the leader. The manifestation or the presentation of RSV infection is wide ranging. It may be a very mild cough and cold, or sometimes it may be very severe also, which may require admission of the baby. But the unique fact is that almost all the babies do suffer from RSV infection till they are 2 years old. It is very common, and often it's quite difficult to prevent also. What, as a pediatrician, what we are worried about is that the children who develop the complication, like the fast breathing, or some babies they are unable to take feed, so they are at risk. So these babies often need to be admitted to the hospitals for oxygen, for saline, because due to their fast breathing, they often developed dehydration. Now, as parents, how to identify whether the baby is suffering from RSV? Well, by one look, one cannot say which virus is affecting the respiratory system. But if a small baby is having very fast breathing, that means the chest is moving up and down very fast, more than the usual that you have observed the baby. The baby is unable to suck at the breast or feed. The baby is either restless, crying incessantly, or very lethargic. In these situations, one must be very careful that it's one of the viral respiratory infection. And among the plethora of viruses that may cause respiratory infection, respiratory syncytial virus is the commonest. And typically it affects the small babies. That's why we have to be very careful for these babies.
Thank you so much, Doctor. So, before we go any further, I would like to invite all the parents once again. And during this workshop, Dr. Jaydeep will be answering your questions live. So, if you have any queries, please feel free to share them with us in the comments. So, Dr. Jaydeep, how is RSV different from common cold?
See, common cold will have more of a running nose,
Okay.
Common cold will be there will be redness in the nose, around the mouth, and all that. It will be more of a sneezing with running watery nose. But RSV, on the other hand, it affects the lungs also. Common cold affects only the upper respiratory passage, whereas RSV affects the lungs also. There will not be very severe running nose. It may be some blocked nose, but along with that, the fast respiration, lethargy, or inability to feed are the hallmark of RSV infection.
Okay. So, thank you so much, doctor, for answering. Now, our next question is, why is it important for parents to know about RSV?
Yes. See, you have heard of so many viruses, particularly after the corona outbreak. You have come to know that there are so many viruses like influenza virus, like adenovirus, which affects the respiratory system. Now, among all these, RSV has a very unique age of presentation. It affects mainly the very small babies right after birth to approximately 1 to 2 years of age. It's the most severe. We, as doctors, we term this as bronchiolitis. That means the bronchus, that means the respiratory tree, the tree inside the lung, that gets affected and it becomes very sensitive. So one has to be very careful about RSV because it affects, number one, the small children. Number two, there may be very fast breathing. The baby may not be able to take feed. There is chance of dehydration. Sometimes maybe 2 or 3 out of 100 babies suffering from bronchiolitis may need admission in intensive care unit just for oxygen or for nutrition. So this RSV infection can turn out to be very severe because these babies are small and they might have difficulty in breathing. So RSV one has to suspect, and it's time that you must know about this virus other than the influenza and all that. See, influenza can affect many ages, and influenza usually doesn't affect very small babies. But RSV is one infection which can affect right from birth.
Okay. Thank you, doctor. That information really helps the parents who are watching this live. Before we continue, I would again like to remind the parents that we are taking questions in this live session. So feel free to share any queries that you have in the comments. So, doctor, let's proceed with the next question. Is RSV contagious?
It is contagious among the babies. Actually, RSV, the respiratory syncytial virus, it circulates in the atmosphere, and the babies, they get the viruses because the babies often, they do not have enough power in their immune system to protect from simple viral infections, so they may get it from the environment. Usually this RSV virus can affect all the babies, all the young infants and all the babies, and it is very easily transmitted. That means often you have heard, especially during corona, that one person of corona can transmit to 2 to 3 persons. But RSV infection, this transmission is much higher. It may transmit to 4 to 5 babies. So that propensity of RSV infection and the transmission of RSV infection can be very heavy and can be very fast. Particularly, this the chance increases, the RSV infection and transmission, the chance increases if there is overcrowding. That means many people are occupying a room. Then, if there are some indoor pollutants like smokes, any smoke generating mechanism like cooking or other the incense sticks and all that, indoor smoking. Now, if there is this type of indoor pollutants along with overcrowding, then there is always chance of transmission of RSV more than usual. As it is, RSV is very easily transmissible. That's why the small babies they get RSV very easily.
So, our next question is like, for how long does the infection last?
See, the presentation may be varied. Often, the RSV infection, or what we term as bronchiolitis, is mild. It may last for 3 to 4 days, but sometimes this may get prolonged, maybe about a week or 10 days. The respiratory rate or the fast breathing may persist. The baby may not be able to drink properly. So, on an average, it is 4 to 5 days, but sometimes the suffering may be prolonged to 7 to 10 days, and the severity also may vary. The manifestation of RSV infection may be mild, but what we are bothered, what we are concerned is about those RSV infection which causes a lot of impairment in normal respiration or normal feeding of the baby. So those babies need hospital admission, oxygen therapy, saline therapy, and other special cares as judged by the treating pediatrician. So the suffering, well, 4 to 5 days to about a week, and also the severity may sometimes vary.
Okay, thank you
As a
so much.
matter of fact, yes, any questions?
Yeah, so is it like the time of infection, it varies from baby to baby?
Yes, it may vary from baby to baby. It's not uniform. It's not that all the babies will have infection for 7 to 10 days. Generally, it's 4 to 5 days. Sometimes it may be 7 to 10 days, and also the severity may vary. It may be mild, it may be quite severe, requiring intensive care management.
Okay. So our next question is, what are the common modes of transmission?
As it is a respiratory infection, it is commonly transmitted through the respiratory secretion and in the air.
Okay.
Just like most of the respiratory viruses which are transmitted through the air. But again, the other, what we call medically as fomites, like the hands, like the other materials which may get contaminated with respiratory secretion, if they are brought in contact with the baby, it may also transmit, because this virus may survive in the hands or in some objects for some time. So other than the airborne infection, by the droplets, the small particles which are not visible, they may transmit the virus. Other than that, the hands and also other materials coming in contact with the baby, which are infected, carrying the virus, they may also transmit the virus.
Okay. Thank you so much, doctor. So, are there any complications associated with RSV?
Yes, though generally, I must re emphasize, generally, RSV is a mild infection. But why we are concerned? We are concerned because RSV affects very small babies. So, though it's apparently mild infection, but in small babies, due to high respiratory rate, they may be suffering due to lack of oxygen. They may not be able to breathe properly. They may not be able to drink properly. So it's the concern is because of the age and because of the state of the baby. They
Okay.
have their limited capacity. So it's not always severe, but always it may turn severe. And that is why all the parents, they must be aware enough to detect it early. If the baby is breathing fast, unable to feed, very cranky, very lethargic, they must consult a pediatrician, because that's the early sign, and earlier it's treated, probably the less will be suffering. So it may vary, many may sometimes, as I have been telling, that some kids may need ICU admission also with oxygen therapy, nebulization and others. So the manifestations may vary.
Okay. So, why are infants more susceptible to RSV?
See, during the first 6 months of life, an infant is protected from the disease by the antibodies of the mother, because their immune system is not that matured. That is why, for other diseases also, say the triple antigen, hepatitis, you know that babies are getting, why they are getting vaccines so early, because they do not have their enough capacity to prevent that disease. The partial prevention is from the mothers. Now, RSV infection is one which sets in these small babies who are relatively immunocompromised. Even the healthy babies, their immune system is not that matured. So they are more prone to. On top of it, if a baby, some babies, they have some heart problem, some kidney problem, some lung problem, there the chance of RSV infection is more. So due to this lack of maturity of the immune system, together with prevalence and circulation of RSV virus in the atmosphere, they are more prone to get RSV infection.
So, doctor, are there any preventive measures that parents can take to lower the risks of RSV infection in newborn children?
Absolutely. Number one, hygiene is most important
Okay.
for any disease and particularly for RSV. Now, whenever somebody is picking up a baby, if somebody is coming from outside, before touching the baby, one must wash the hand. Even if somebody is doing some other work, then they want to attend the baby and take the baby, they must first wash the hand before taking the baby, because as I have been telling, that it can be transmitted from hands or other materials also. Second, if somebody in the family, especially who are coming in close contact with the baby, are having cough, cold, fever, they must try to keep a safe distance from the baby and also use a mask,
Okay.
so that it is not transmitted by the nasal secretions or by the air that's being shared. So
Okay.
hygiene, awareness about the disease is most important. Third, as I have already told, is the indoor pollution. One is overcrowding, that
Mhm.
at the best has to be prevented. There should not be overcrowding. And the indoor pollution. If any house is generating smoke inside their room, that has to be prevented. And that has, if it's absolutely required, it has to be outside the house. Second is smoking. See, we are all aware of active smoking, but passive smoking is equally injurious. So
Okay.
nobody should smoke inside the room. Basically, these are the preventions: that hygiene, avoidance of smoke, and awareness. Whenever the baby is having the initial symptoms, one must take to the hospital or consult a pediatrician to detect early, because the parents often will not be able to preempt RSV infection.
Thank you so much, doctor. So, does RSV have a cyclic or seasonal pattern, or it is a risk throughout the year?
See, India is a vast country with varied geographical characteristics. The north is very different from south, east is very different from west. And the weather is also quite unpredictable. In many places, we have rains in the winter, even the summer is very warm. Classically, the RSV circulation is during the monsoon or in the winters. In Western countries, it's mostly in the winters. But in India, the North Indian winter is more akin to the Western countries. So there is some RSV circulation during winter also. In many parts of India, the monsoon is very typical of tropical monsoon, and the viruses, including RSV, thrive during this tropical monsoon. So monsoon is another time. But if you go to the south, there we have a second monsoon during the end of the year also. So then also there is a chance of circulation, and with frequent moving of population from one city to another, from rural to urban, it is very difficult to categorize or characterize. Classically, one must be very aware, and what we see also in our hospitals, that usually around monsoon the chance of respiratory syncytial virus causing bronchiolitis is more. But that doesn't mean that we can sit back and relax in other time of the year, because there are circulations during winters and there are also sporadic cases in other times of the year also. So it's very difficult to just pinpoint.
Okay. So, does it affect all infants or it only affects premature babies or babies born with some condition?
It affects all infants. Most of the babies by the age of 2 years, they will have at least one attack of respiratory syncytial virus. Sometimes they get two attacks also. But premature babies, babies with heart problem, lung problem, kidney problem, they are more prone to get affected by RSV infection. That's for sure. Especially the premature babies, because their lungs is also not mature enough.
Okay. So, doctor, why is it important to consult a doctor in such cases? Like, a lot of people don't do it in case of common cold because it goes away gradually. But in the case of RSV, why is it important to consult a doctor?
Because see, RSV is one infection which is not limited to the upper respiratory tract. It affects the lungs also. Affecting the lungs means there is problem in taking oxygen, because lungs is that structure or organ which supplies oxygen to all parts of the body. So a common cold will not affect the lungs, the respiration, the food intake, and all that. But RSV can affect the lung and the respiratory system as a whole, and the baby may have difficulty in breathing. That's why any baby, I must repeat again, if having fast breathing, unable to feed properly, one must visit a doctor. He will put the stethoscope on the chest and he can find some sounds which may be due to bronchiolitis precipitated by RSV infection.
Okay. So, doctor, in case any of the parents is infected with RSV, what precautions should be taken in that case?
See, adults infected with RSV is very difficult to determine because they have usually very mild infection. So it's very difficult to determine. As I have already told that any adult suffering from cough, cold, fever, respiratory infection, sneezing, if they can, they should stay away from the baby, or if they come in close contact, they should use a mask, and of course proper hand hygiene. Cough etiquette, these are very important. One must develop proper cough etiquette, proper sneezing habit, proper hand hygiene. These are very important.
Okay. So, doctor, what steps can be taken to help a baby with RSV feel better?
Steps means, see, what happens that initially there is there is some nose block. For the nose blocks, one can of course apply the saline nasal drops. But if the baby is really having distress, then it's better to go to a hospital and start oxygen. more so if the baby is unable to drink properly, then it's very essential to give some saline or IV fluids to establish hydration, because if the baby is dehydrated, the respiratory distress will be more. So these basic things one must take care that it should not turn too bad to manage.
Okay. So with that, we come to the end of our this segment. Now our next segment is the parents' question. As I can see, we already have a lot of questions from the parents. So let's start with the first one that is from Neha. She's asking, can RSV affect my baby while I'm pregnant or it affects only after birth?
After birth, only after birth, because during pregnancy the baby is in a very protected environment, because uterus is one of the most protected environment. And during pregnancy the lungs is also not working, it's full of water, oxygen is given by the mother only. So only after birth the baby may suffer from RSV infection.
Okay. Our next question is from Priyanka Jha, who is asking, I am in second trimester and want to know how I can differentiate between common cold and RSV symptoms during pregnancy.
During pregnancy, that means your the mother's RSV. See, mother's RSV, if you want, then it's very difficult to differentiate, because adults usually have very mild manifestation of RSV infection. It mainly affects the small babies, so it will not be possible to differentiate between RSV and common cold. Now, if you are too sick, if any mother carrying is too sick, then may go for the viral respiratory panel, that is the swab from the nasopharynx that we take. I mean, if you remember, during the COVID time it was tested the whether COVID virus was present or not. In same technique, other viruses can also be tested. So if some pregnant lady is too sick, then may go for this virus test. But again, usually it is not required. Common cold and RSV in adults is very difficult to distinguish. Only if the pregnant lady is too sick, then they should take proper medical consultation to go for any detection of viruses. But again, mind you, the virus to the babies will not be transmitted through placenta. So the transmission is usually after birth.
Thank you so much, doctor. Our next question is from Aditi, who is asking, बेबी को आरएसवी हो जाए तो कैसे पता चलेगा?
दैट्स वो वही हम जो बताते थे आपको अभी तक जो बताए हैं कि है, अगर बच्चे का सांस तेज चल रहा है, बुखार हो भी सकता है, नहीं भी हो सकता है, ज्यादातर बुखार नहीं होते हैं, सांस तेज चल रहे, बच्चा ठीक से दूध नहीं पी रहे हैं, और बच्चे का बहुत बेचैनी है, then better to go to a pediatrician to assess, or to a hospital.
Okay, thank you so much, doctor. Our next question is from Arzu Parveen, who is asking, 2-month-old baby RVS symptoms, please. So she's asking about the RSV symptoms in 2-month-old baby.
Yeah, actually, the symptom is generally the same. Initially, it starts with baby a bit fast breathing. Then there may be very fast breathing. The baby is unable to feed or becoming very lethargic. Initially, the baby may be very cranky or crying a lot. Then, if it's still not controlled, the baby may become lethargic. Fever is usually not a very common presentation, but the fast breathing is the generally the main presentation of RSV infection.
Okay, thank you so much, doctor. Our next question is from Parul Sharma, who is asking, my son is 2 years old. He was born with respiratory distress. Is he at risk of RSV?
He was born with respiratory distress. That's what I think she meant. Now the point is that being born with respiratory distress is possibility of some other disease is there. RSV is an infection which is acquired after birth in small babies. So RSV infection is more common in babies or children who is having some other respiratory problem or heart problem, something like that. But a 2 year old child, generally the risk of RSV infection decreases because it's more common in smaller babies. But if your child is having some respiratory problems since birth, then definitely you you have to take proper consultation and see for other conditions other than RSV also.
Okay, thank you so much, doctor. Our next question is from Shaima, who is asking, if a baby has RSV, does it cause long term complications or increase risks of other conditions when they grow up?
No, RSV is generally a severe infection of very small babies only. Now, generally, the RSV does not leave a very long term effect, but if the RSV is not managed properly, detected early, if the child is having low oxygen for a long time or fast breathing, what we call respiratory distress for a long time, that then it may lead to some lung complications. That is why I am again reiterating the importance of detecting early, because there may be some long term effects if it's not managed properly, managed in the right time and managed early.
Okay. Thank you so much, doctor. Our next question is, my baby is on formula as I'm not able to breastfeed. Does this affect his immunity and increase the chances of RSV?
See, breast milk is the best. There is no substitute for breast milk because there are some ingredients in the breast milk, the immunoglobulins, which cannot be artificially manufactured. It's only produced by the mother in the breast milk. So, breast milk definitely protects against many diseases, including RSV and other respiratory infection. Now, there are certain conditions, certain situations when the mother is compelled to give other milk to the baby due to some situation. Well, that is not the sole criteria for getting an RSV infection. A baby who is not on breastfeed, he or she may not get RSV infection at all, because it depends on so many other factors, whether there is RSV virus circulating in the environment, whether the adults are carrying the viruses and transmitting to the child, overcrowding, smoke, and others. So there are so many factors, but definitely, if possible, breastfeeding can be initiated at any time, and that is the best.
Okay. Thank you, doctor. Our next question is from Pragya. The question is, किस एज के बाद आरएसवी होने का चांस कम हो जाता है बताइए प्लीज.
जनरली 2 साल के बाद थोड़ा कम होते जाता है, और ये आरएसवी इन्फेक्शन ज्यादा जो सीवियर होता है वो जनरली बर्थ के बाद 6 महीना 1 साल तक, उसके बाद होने का चांस थोड़ा कम हो जाते हैं अगर बच्चे का दूसरा कोई बीमारी नहीं है. अगर बच्चे का दूसरा कोई लंग्स या हार्ट का बीमारी है तब उनका आरएसवी होने का संभावना ज्यादा होती है.
Okay, thank you, doctor. Our next question is from Sudha. My 7-year-old loves to play with her 3-month-old brother, but it is quite difficult to make sure that her hands are clean and she is not carrying any germs. What should I do? Do not want to scold her for playing with her baby brother.
No, 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 don't, please don't deprive the sibling bonding and the beautiful time that the elder sibling will have with a younger sibling. And that's a great developmental stimulation for the younger baby also, from the mental stimulation that's offered by playing with a sibling. So please do not deprive that. Now, a 7-year-old child, you can just teach slight hygiene like hand washing, not sneezing near the baby, or just keeping things clean. So that can be just explained to a 7-year-old baby. Rather than isolating them, encourage them to play together, but do inculcate the proper hygiene and some basic precautions to the older child.
Okay. Thank you, doctor. Our next question is from Geetanjali Bose, who is asking, how to know if my baby is at risk of developing RSV?
See, this is a very important question. Number one, a premature baby is more at risk of developing RSV. Number one. Number two, any baby with other congenital problems like lung, heart, kidney, etc., they are more prone. My point is that all the babies are prone, particularly by 1 year, because their immune system is not that developed. But if some baby is having other complications also, then their chance is more, and also prematurity.
Okay. Thank you so much, doctor. Our next question is it's from Riddhi. We often have guests staying at our place. They play with my baby who is 1 month old. Can this increase her risk of getting RSV?
See, as I have told, the more the contact, the more the crowding, the chance is more. Often, socially, it's not possible to isolate the baby and not to allow others to touch. But at least for the sake of the baby, you can request them not to come very close to the baby. Some people, they put their mouth close to the baby's mouth and all that, so this is risky. And of course, as I have been telling, the hand hygiene, the washing, the cough etiquette, the smoke, this somehow we have to manage for the sake of the baby, because that's basic hygiene that I do agree that many Indians, as Indians also, most of us are lacking.
Okay. So, doctor, our next question is from Survi, who is asking, I've had frequent respiratory infections during pregnancy. Does this affect my baby's chance of getting RSV?
No, I have already told that RSV is an infection which is transmitted by air, through fomites, through close contacts. A mother having frequent respiratory infection, that may be due to many viruses, including RSV, but that's not the common way of transmission of RSV to the babies. We have to be more cautious after birth, and also especially in premature babies.
Okay, thank you, doctor. Our next question is from Jaya Lata, who is asking how to manage RSV at home. Any home remedies that work?
Home remedies, see, initially, if the baby is having nasal block, fast breathing, you can try with saline nasal drop. But if the baby is having fast breathing with indrawing of the chest is moving up and down too fast, do not take chance. And please do not apply mustard oil for any remedy, because mustard oil is not a medicine. It doesn't cure any disease, it only precipitates disease. So don't put mustard oil in the nose, coconut oil in the nose. Please don't do it. Only saline nasal drop can be instilled. Other than that, home remedy, if at all a baby is having fast breathing or unable to feed, is not possible. Better to take to a hospital early rather than landing up in any complication.
Thank you so much, doctor. We might be having more questions coming up. So, by the time we do, can you please share can you brief about the topic in detail a little?
See, RSV is a common virus. It is present in the environment. It is always present in the environment, but it is more commonly transmitted and circulated around monsoon and also during the winter. The
Okay.
small babies, they are more prone to get RSV infection by 1 to 2 years of age. If the baby is premature, if the baby is having other conditions of heart, lung, kidney, etc., their chance of getting RSV infection is more. RSV is not a common cold, because RSV affects the lung. It causes fast breathing. It causes low oxygen delivery to the body. The baby often is unable to take proper feed, that may lead to dehydration also. So RSV many times is very mild and very simple, but sometimes it may turn out to be very severe due to fast breathing, due to lack of feed. So we have to, number one, prevent RSV. The most important way of prevention is proper hygiene, proper distance, awareness of RSV, and then comes early detection. Early detection is very important. If the baby is having early signs of fast breathing or unable to feed, then we have to take medical consultation to see early, because doctors can put the stethoscope and they know how to assess a child with RSV. It's very difficult to assess by the parents or caregivers because the babies cannot communicate.
Okay.
Babies cannot say that I am having this problem. So that's a very important. We have to think of it very early. And definitely in the winter month and all, please do not generate any smoke inside the room. That will trigger more RSV infection.
So we have one question from Nirmala, who was asking, can RSV be more severe for babies born prematurely?
Yes, yes, of course, of course. Actually, as I have been repeatedly telling, RSV virus is an infection which affects not only the upper respiratory system, but it affects the lungs also. And the premature baby, their lung is not as developed as a mature baby. So their lung is always prone to get RSV infection and severe RSV infection also. So that's an handicap. Definitely, prematures are more likely to get RSV infection.
Thank you for answering, Doctor. We have another question from Ananya, who is asking, is RSV common in India? I have never heard about it.
Yeah, actually, see, this virus is there since ages.
Oh,
Now, the awareness of some viruses, they go up gradually, like we did not know about coronavirus, but it was there. It manifested in a severe way. Then, long back, we hardly heard about dengue virus. It's common now. Similarly, adenoviral infection. Similarly, RSV infection also. Now, RSV was there, but the awareness of RSV was not as much as it's now, because people used to club all the viral respiratory infection as one infection, like
okay.
common cold. But all common colds are not so severe. Common cold is caused by rhinovirus, metapneumovirus, which are relatively mild viruses. But RSV is one virus which may be severe in some children, not 100%, I must say, but it may be severe in some children. That's why we have to be aware. That's all.
Okay. Thank you so much, Doctor. So, is it possible that a child gets RSV again? Like, is it recurrent?
It recurrent means one can get a fresh infection. That's what one can always get. See, even a common cold you can get many times. So RSV infection, you can get a fresh infection. That's the possibility is always there.
Okay. Thank you so much, Doctor, for sharing this information with us. With that, we come to the end of this live session. And as we are coming to an end, I would like you to say a few words and to sum it up.
See, your baby is precious. That's for sure. And you are totally focused on the well-being of your baby. So, to bring up a baby properly, number one is breastfeeding as much as possible. Number two is hygiene is very important. Proper care that the common infections are not transmitted. That includes RSV infection also and many viruses. So, proper hygiene. There should be less smoke generation. The indoor pollution is a very, very big issue in countries like India. So we have to be very careful to take care of this and detect early. If you see that a small baby is having some breathing problem, do not hesitate to go to a hospital. It may not be so severe, we will be happy, but it should not turn severe. So prevention is most important. Hopefully we should not go for curing, because that may be a very difficult phase for the baby, for the family, and also a great burden to the society also. So let's hope that it is prevented.
Thank you so much, Doctor. It was a pleasure having you here.
My pleasure. Thank you so much.